Hello, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix, Arizona. Today I'm at one of the Phoenix Points of Pride, which is the South Mountain Park here in the south part of Phoenix. It is very large. It comprises over 25 square miles, over 20,000 acres, and it is the largest city park in the United States. It is known for a few things. One is there's a very large population of an animal called a chuckwalla here. Never seen one, just seen pictures, but they look pretty cute, at least in pictures. It was bought in 1924 by the city of Phoenix from President Calvin Coolidge's administration for the grand total, get this, $17,000. And at that point they bought 16,000 acres. So imagine that what would cost today. Over the years, the city of Phoenix has bought more and more acreage, and it is preserved. It's kept up by the park rangers and the city. Absolutely gorgeous. You can see behind me, a lot of the radio stations here in Phoenix utilize the top of South Mountain for their towers. And at night, it really is attractive, the red lights that kind of blink on and off. The topic for today is radiofrequency ablation. It's a fancy term, but it also goes by other terms like radiothermal coagulation, radiofrequency coagulation, thermal ablation, those types of things. But it's not such a fancy procedure. It is one of the most technologically advanced pain management procedures that have come along in the last 20 years. Let me explain what it is exactly. If you have neck pain or low back pain that is chronic and not getting better with conservative measures, such as physical therapy, chiropractic, spinal decompression, or acupuncture, those aren't in and of itself getting the neck pain or the back pain better, or they've gotten maybe 50% of the pain better, but the patient and the doctor wants to work to get more of that pain relief in place. Radiofrequency ablation may be a great treatment. If you do an injection, if a pain doctor does an injection into the facet joints, which are the tiny little joints on both sides of the neck and the low back, at each level of the spine, that may give pain relief from arthritis, injury, for days to weeks to months. But it is rarely a very long-term viable solution. You want to avoid surgery, but you also want to get more than 48 to 72 hours of pain relief. If the injection works and then wears off, you have a few options. One is you may be at your wit's end and opt for surgery. But if it's a quality of life decision, wouldn't it be great if you could avoid those risks? Another option is to repeat the injections. That may be a viable option. But a very good option in this day and age is radiofrequency ablation. It's an outpatient procedure. The pain doctor at Preferred Pain Center, ours is board certified and fellowship trained. He can, under the x-ray guidance, put a needle with numbing medicine into the joint or joints that are causing the pain. And that needle gets heated up safely and can deaden those tiny little nerve endings that are causing the pain from either the arthritis or post-car accident or whatever's causing the reason for causing the pain. It's those little nerve endings that bring the sensation to that joint. Well, the radiofrequency ablation can deaden those little nerve endings, and it can give relief for, get this, studies show 270 days upwards to almost 500 days. So you're talking about 3/4 of a year to almost 2 years, a year and a half. Dramatically longer than just getting a simple injection. So, like I mentioned, it's one of the most technologically advanced procedures that has come along in pain management for the last 20 years, and we offer it at Preferred Pain Center. Please check us out on the internet at www.preferredpaincenter.com. You can also put a /blog on the end to see the blog of pain. We have lots of videos, educational animations, testimonials. It's all there. You can also call us at 602-507-6550. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.